Good afternoon. We'll get started in a few minutes, a minute or so. All right, so good afternoon, everyone. This is the webinar for the third cycle for the South Jersey Institute for Population Health. We're excited to launch this third cycle. So our agenda for today will be to go through an introduction. Next slide, please. Go through an introduction, and then we will talk about the purpose of the funding initiative, the key dates, evaluation and review, and then we have a number of frequently asked questions that we'll focus on, and then we will end the webinar. So I'm Dr. Nicole Vaughn. I'm a faculty member at Rowan University in the Rowan Virtua School of Nursing and Health Professions. And my co-lead with this institute is Dr. Naomi Marmerstein at Rutgers University, Camden. And we have been leading up this Cycle 2 initiative, and we'll be leading up the Cycle 3 initiative. Naomi will come on in a few slides and talk through some of the options we have here for this funding cycle. Next slide, please. So our staffing at the Institute, we're a small but mighty team. So we have Chriselle Allen, who is part-time with Rowan University as a public health analyst. We also have Corey Hoffman, who is the coordinator for academic programs with the Rowan University Rutgers-Camden Joint Board of Governors. Next slide. And we have a new operations and research coordinator who's also part-time, Ms. Shania Terry, who is also with the joint board. So by way of introduction, so the Rowan University Rutgers-Camden Board of Governors was designed and established through a state grant to integrate the region's medical, educational, research, and community assets for the benefits of the residents of Southern New Jersey. So our focus is really in the 7-county Southern New Jersey region. Our main goal is really to improve health and health equity, focus on population health, population medicine, population and public health approaches, and really begin to engage our researchers with community and community stakeholders to make sure that the work that we're doing has impact and is relevant to the needs of the community. When we were designing this initiative, our values were really central to the work that we were doing. We were focused on collaboration, innovation, and impact. And by collaboration, we really want to make sure that the work that we're doing, we are actively listening to all partners as a part of the work, that they are mutually being listened to, as well as the projects are really full engagement with all stakeholders. So we really don't want one project to have, we don't want any of the projects to have a lead that doesn't incorporate the voices and the ideas from the community, as well as the other academic partners that are a part of the project. We really also are striving for innovation. We really want to focus on new ideas. We want to be open to explore ideas that have a sustainable impact. We want really to push the boundaries and start thinking of things in different ways. Our region is really focused and special, and in our region, we know that there's going to take innovative solutions, right? We have urban, we have suburban, we have rural issues, and that's going to take a lot of innovative ideas that we need to push forward. And then finally, impact. We really believe that Southern New Jersey is unique and a valuable place, as I mentioned, a special place to live and work. And so we really want to make sure that the work that we're doing has impact and is inclusive and is long-lasting. So the purpose of the South Jersey Institute is really to serve as a hub for research collaboration, community connection, and innovation, and really focus on health equity and improving health for populations in their region. We are open to all approaches that focus in health equity. We really want to expand the research within our region. So the projects that are that we have funded and will continue to fund will be in one of the 7 counties, or they can be in multiple of the 7 counties that you see listed here. As mentioned, we have urban, suburban, and rural issues. So we want to focus on diverse communities. We're not focused on one particular type of community. We want new ideas that really show us relevant data and that can be used to really highlight what the region has and ways that we can improve and answer new research questions. And then finally, we're focused on partnerships. And we understand when we were designing this initiative that there will be new teams coming together, which we absolutely want, and there will be established teams. And so you can see the definition there. So new teams are teams that are coming together with less than 6 months. Established teams are teams that have been working together for 6 or more months. We also can fund previous awardees as well as larger projects in this Cycle 3 initiative. On your screen, you see that these are the key dates and our timeline for this Cycle 3 initiative. So we released the RFP last Monday on May 1st, and the application portal is open as well. The letter of intent will be due on June 23rd by 5 p.m. and you'll submit that through our apply.sjiph.org portal. The review of all LOIs will happen by a committee, review committee and staff, and that'll be completed by late July. Applicants will be notified around mid-August whether they are invited to participate in the sandbox meeting, and I'll talk a little bit more about what the sandbox meeting is. The sandbox meeting will occur on Friday, October 13th, 2023 in Camden at the Joint Health Sciences Center, and selected LOIs will be invited to participate. So those LOIs that have been reviewed by our reviewers and deemed eligible to move to the next phase will be notified in mid-August and be expected to come to the Joint Health Sciences Center in middle of October. The final proposal will then be due on November 17th. You will receive feedback during that sandbox meeting, and that feedback will be incorporated into the final full proposal. And then awarding decisions will happen in mid-December, and then the funding will be released. Contracting will happen between January and April, and then projects have a 12-month cycle. There will be internal reporting, so we will have quarterly updates from all grantees throughout the grant year, and then a final report will be due to the Board of Governors in spring of 2025. So the areas of focus, our projects at the beginning, you do not need to have all of your partners identified. As mentioned, this is a 3-legged stool, meaning that there is a Rowan faculty, a Rutgers Camden faculty, as well as a community partner and community stakeholder. Having at least 2 of those partners on board by the time of the sandbox meeting is extremely important, and we really encourage partnerships and teams to begin to find their partners early on in the process. The earlier, the better, so you can really bring your partners together at the LOI stage. We really will be looking at the focus and content. So what's the population? What population does the project focus on? What is the capacity? Does the project really build on what the community has already going on? Is it responsive to community needs? In terms of disparities, is it a project that's focused on reducing disparities or advancing health equity in our Southern New Jersey region? Will the project generate any data that can be shared? And then finally, will the project generate a new partnership or really enhance or deepen an existing partnership? So we're really looking to look at those areas within the applications that are submitted. So this is our review process. All LOIs are reviewed by the SGIPH staff and submitted to our external reviewers. The review team is made up of faculty from Rowan University, faculty from Rutgers-Camden, and community stakeholders. That is there's a small review team that reviews each application. Each application has a thorough review and is scored on the criteria that you'll see below. And those criteria are the research idea, your project idea, the collaborative team who's been brought to the table, the data sharing capacity, the impact that the project will have in the region, both in the community as well as in the scholarly arena, sustainability of the work, as well as the budget. Does the scope of the project fit the budget that has been outlined? And so this, the highest scoring projects and projects that fit within those criteria, as well as are deemed appropriate by the reviewers, will then be asked to come to the sandbox meeting for further development of their proposals in mid-October. So now I'm going to turn it over to my colleague, Dr. Marmerstein, and she will walk you through the budget.
Thanks, Dr. Vaughn. Awesome. So the funding for cycle 3 will be quite similar to the funding for cycle 2 for those of you who are familiar with that. There'll be two distinct budgeting tracks. Track 1 will fund up to 12 projects funded at up to $25,000 for a total of up to $300,000. And any project team, new or existing, is eligible for track 1 funding. So if you don't have all 3 partners already set up into a collaborative team, this is what you're aiming for. Track 2 will consist of 2 to 4 larger projects that will be funded at levels between $50,000 and $100,000. To be eligible for track 2, you can either have had a previous SGIPH award, and therefore by definition be an existing team and have, as long as you've successfully completed your project, or be a team that's already established in some other way. So all 3 partners have worked together for 6 or more months on previous research and have a successful history of collaboration. So if you've been working with somebody across both universities, with a team across both universities and with a community partner for at least 6 months, and you have an idea for a project that is a bit larger, you're welcome to apply for track 2. Next slide, please. Oh, we're already at Q&A.
Yeah, so we have a number of frequently asked questions that we can go through. So next slide, please. And I think we can answer, and this is also appears on our website. So Naomi, do you want to go through this first one?
Yeah, I can start going through, and also as we go, maybe people can feel free to post questions in the chat. And so if anything isn't covered in these FAQs, we can answer those as well. So the sandbox meeting is to bring together teams from the successful LOIs, the LOIs that have been selected by the reviewers to advance to the next stage. The projects have already been deemed promising, and the sandbox meeting is intended to serve as an incubator for ideas and research partnerships. So at the sandbox, all of the team members that have signed on to the project are there, as well as a team facilitator who's meant to sort of ask informed questions that advance the thinking about the project and prepare the team to revise the LOI into the final proposal that's due a little bit after the sandbox. Is everyone required to attend, and will it be in person? Yes, everybody has to be there, or sorry, every project must be represented, and the event is in person. Well, invited projects require Rowan and Rutgers-Camden researchers. So every project requires the 3 distinct partners, 2 academic, Rowan and Rutgers-Camden, and a community partner. Priority will be given to projects that include Rowan and Rutgers-Camden faculty collaborations and or those that have academic partners from more than one institution. So I think this is later in the FAQs as well, but if one of the partners is a student, for example, a graduate student at Rowan or Rutgers-Camden, they need to have a faculty sponsor. And this assists with the completion of the project, make sure it happens, and also assists with things like IRB review, where you're required to have a faculty sponsor. Next slide. Nicole, I'll do this page and you do the next. Is that good? Okay.
Sure.
Who counts as an academic partner? Faculty, they don't have to be tenure track necessarily. Postdocs, staff can also count. Students and staff can serve as key personnel, but a faculty, I just said this, must serve as a PI, co-PI, or investigator on the project. What units are eligible? Rutgers, Camden, Rowan, Rowan School of Medicine, and Cooper Medical School of Rowan University. Are there restrictions? So there are many allowable expenses, percent effort for the people on the project with no individual person receiving more than 20% of the grant. Hourly student wages, supplies, materials, equipment, mileage reimbursement for study-related travel, travel for students to attend professional conferences, software, data analysis, evaluation, and publication subvention. Non-allowable costs include food, except as related to human subjects research, and equipment exceeding $3,000. There's a 10% indirect cost F&A cap, as the funds are New Jersey state government dollars. Will data collected be required to be shared with SJIPH? So all projects require a data sharing plan, but not all data that are collected are required to be shared. So you need to describe in your proposal exactly what data can be shared in what form. What if I don't know a Rowan or Rutgers Camden academic partner or individual? First, look through websites at each university. It's a first step to identify potential partners. You can also email at info@sjiph, and our staff will do the best to identify potential partners at the universities. And Nicole and I do this all the time. We reach out to our colleagues and we ask if they're willing to partner with someone at the other university, and we're truly happy to do that. Please note that it's not our responsibility to. So we may try, and occasionally, to be blunt, we fail. It's not our job to, in the sense that that you're still obligated to try to find someone yourself, but we will do our best to reach out to our colleagues and try to find someone for you if you're stuck. Next slide, and I'll hand it over to Nicole.
Sure. So can the funding initiative support programs as opposed to research? So the funding can support programs as long as there's a specific research question or data that supports the broader mission of SJIPH. So we really are focused on health disparities reduction, focusing on health equity. We take a really broad stance with that. However, we really want to make sure that the dollars are spent around research, right? So there needs to be a specific research question and not just funding that's going to support a program that's already existing or to just sort of continue something that's already underway. Does the project have to be in Southern New Jersey? Yes, it has to be in at least one of the 7 counties in Southern New Jersey. It can be in multiple. It can cover all 7 counties. There is no restriction. We are focused across all of those regions. So it is up to that team how they want to focus their projects. If my project is funded to the Sandbox meeting, what are my chances of being invited to the Sandbox meeting? So our goal is really to fund the majority of the projects that are invited to the Sandbox meeting, provided that their full proposals really address the funding criteria and research priorities. However, all projects that are invited to the Sandbox meeting are not guaranteed funding. We will be giving you lots of feedback. Reviewers will be giving lots of feedback, and there will be a final full proposal. There is a separate review process for the full proposals. So even though projects are invited to the Sandbox meeting, that does not guarantee that they will be funded. Finally, can previous awardees apply again for cycle 3? Yes, we are open. So previous awardees are welcome to apply to cycle 3 funding if they have the following conditions. 1, the cycle 3 project must be distinct from the previous cycle's project. So it must be distinct from cycle 1 or cycle 2. And the teams must demonstrate significant progress and or have completed their previous projects before applying to cycle 3. We are open to projects that have been previously funded as long as they are new and distinct. They can have similar partners and can bring in new partners, but their previous cycle projects must be completed before applying for cycle 3. Is the funding for this initiative from federal or state dollars? And if so, are there restrictions tied to the government agency that the applicants should consider? Yes, so this funding is considered New Jersey state government dollars, and there is a 10% indirect cost cap. This year for cycle 3, we have allowed publication subvention which could be added into your budget. That was approved. So we are able to do that, and that you can see reflected in our new RFP. Are the names of previous grant award winners and projects and the projects that they submitted available? They are on our website. Our website will be refreshed again tomorrow morning. So cycle 2 grant awardee winners were just announced last week in a press release, but cycle 1 projects and cycle 2 projects will appear on our website. So you can see the other projects that have been successful and that have been underway. Does this initiative intend to focus exclusively on research at this stage, or would there be an opportunity to fund application-based initiatives that align with the Institute's mission? So we're really focused on projects that engage community stakeholders and academic partners together. We're really focused on projects, as I mentioned, that have a specific research question and that data can be generated to explore a health-related issue. And then finally, are there health issues that we are prioritizing? We are really interested in projects that address the social determinants of health, health disparities, healthcare access, and health more broadly. At this stage, we're not focused on any specific health issue. We're focusing on welcoming all ideas as long as it meets the criteria that are outlined. There are no restrictions. We really sort of, like I said, really cast a wide net in terms of the social determinants of health, health improvement, health promotion, public health research, population medicine health research. We're looking for, data projects, feasibility studies. So we really cast a wide net, but there needs to be a specific research question as a part of the proposal. Next slide, please.
Dr. Vaughn, I just wanted to cue you into a question that's in the chat that Dr. Spencer asked.
Sure, let me take a look. What's the question?
It says, our cycle 1 project has been very successful and we have received a 6-month extension to finish it. You just mentioned that our cycle 1 project must be complete before submitting for cycle 3. If we have expanded our budget and collected all of our data, would that count as being complete? The extension takes us through September 2023, but we will have spent down our budget by the end of June and we'll have collected all of our data by then.
Yeah, so if all of your data is collected and your budget is fully expended by then you can use your data from that project to serve as preliminary data for cycle 3 project.
What if it's a new project?
Your new project, so we have to, for all projects, they have a established criteria. So in the when you apply, you'll talk about you can talk about your previous cycle 1 project. We do ask about that if you've been funded before and sort of what you've done and what you've been, and then how this project is new and distinct. So it definitely will be a new project, but we want to actually show that there was success in the previous project. You've collected that data, you have something to show for that project, and then now you're moving forward with this new distinct project. Great question. The other question, so how will the collaboration criterion be evaluated if all partners are not identified? We are, like I mentioned, really casting a wide net. We understand that there will be some new projects that are coming together in new teams versus established teams. So we really encourage all projects to really share their ideas. We want to be innovative. We really value that collaboration. So the project idea and the impact is really weighted more heavily in terms of the project, in terms of what's being evaluated. So and then we do review new and established projects in separate applicant pools because we know that new and established teams, have different, different standing. There's projects that if you're new, you're reviewed in the new category, and the established are reviewed in their own separate category. The LOI projects that are selected for the sandbox meeting will have their opportunity to develop their ideas and develop partnerships further, but we really want you now, as you begin to think about your project and your project ideas, to really think about who would be the most appropriate partners for your project, and begin to reach out to them now to begin to get their ideas incorporated into your LOI. That's what we've seen the most success, is that if you can come to that sandbox meeting, if you're invited, having all of your partners at the table ready to work and discuss and really refine your idea really works the best. And as Naomi mentioned, we are willing to help you find people, but we are not responsible for making sure those partnerships stick. We can sort of lead you to those partnerships and connect you, but it's really the team's job to really work and spend that time together to see if they all can work together and put together a successful proposal. The other question is, are health systems eligible to serve as community partners? Yes, health systems are welcomed to serve as a community partner for this funding initiative. Next slide, please.
Dr. Vaughn, just wanted to mention another question in the chat. Leslie, didn't forget your question. It's coming up in 2 more slides, but Janine Kava just asked a question. I will read it. Our Cycle 1 project did not require us to have faculty from Rowan and Rutgers-Camden, but rather students who were not required at the time to have a faculty supervisor, given the new guidelines of the new RFP. They do. These 2 students have now both graduated, but we would like to apply as a team who has worked together for 6+ months, which 2 of the 5 of us would be. Would it be best at this point to try to find both Rowan and Rutgers-Camden faculty via your website, as you mentioned before?
Yes, it would be good to find Rowan and Rutgers-Camden faculty to join your project. As you can see, our new criteria do have a requirement for a Rowan or Rutgers-Camden faculty to be a part of the proposal. They can be one of the investigators precisely to this point. We know that when students are involved in projects, they are only there for a short amount of time. And so we really need these projects to have more consistent leadership. And so finding a Rowan and Rutgers Camden faculty member to be a part of the project would be a requirement for Cycle 3. Okay. On the SJIPH website, there's a statement around the budgets that projects that can identify matching funds or include in-kind support should be submitted. Can you provide some more detail? So if you currently have funding from another source and would like SJIPH funding to build on or expand the work you're already externally funded to do, you're allowed to apply for SJIPH funding initiative, but you have to disclose your other funding sources. We have had projects that have had in-kind dollars. So if in-kind dollars are a part of your project, you can put that in as well. There's a detailed budget spreadsheet template that we provide that you can use. Matching funds, in-kind, and other support are not required for this funding initiative. So these projects are going to be evaluated in the same way as those that do not have those supports. So if you are leveraging other funds, please do tell us and let us know, but that does not give you an edge in review to other projects that might not have those other types of supports. And then in terms of our other educational institutions other than Rutgers-Camden or Rowan University allowed to collaborate on the initiative? And the answer is an absolute yes. We have had other institutions around Southern New Jersey participate. So that includes community colleges, other universities in our region. We've had other universities, even in the northern part of the state, that have participated, but we have to identify a Rowan University and Rutgers-Camden researchers that are on the team. So those 2 requirements have to be there. There can be other other individuals from other universities that are part of the project, and you must have a community partner on the team. So the reason for this is that this funding, so the joint board is really designed to really enhance the collaboration between Rowan University and Rutgers Camden, particularly because the health disparities in our region have really, been exacerbated when you look at all of the data, and really to engage community stakeholders from that region. So really we're focused on Southern New Jersey, and this funding is for the Rowan Rutgers joint board. So all those projects must have at least those 3 partners and can have additional partners from, like I mentioned, other colleges and universities in the state as well. Those projects should have your final LOI should be submitted by June 27th for this funding cycle. Next slide, please. Naomi, do you want to take this?
Sure. This is a question that we got about eligibility for track 2. Team members from previously funded SGIPH projects are eligible. Does this mean that a team member from a community organization that partnered with the lead entity on a Cycle 1 or 2 award could apply for funding at the track 2 level with new partners, even if they're not the entity that received and managed the funding for Cycle 1? This is the whole Cycle 1, track 1 and track 2 is more complicated than it sounds, isn't it? If you have a working partnership in which you collaborated for 6 months or more and are looking to expand your partnership to add new partners for this funding initiative, your project would be considered an existing partnership. But if you're looking to apply with a different set of partners, you're eligible for track 2 only if you have collaborated with these partners for 6 or more months. It's crucial that any team applying for track 2 have a history of collaboration and that they know how to work together efficiently and successfully in research.
A question from the chat from earlier, getting more specific. Leslie Spencer asked if the Rowan and Rutgers partner, so 2 of the 3 partners, have worked together on a prior project successfully, and the current project will involve an additional partner, the 3rd partner with whom they've only worked with for 2 months. Could they still pursue track 2, or do they need to stay with track 1?
Nicole, do you want to take this or do you want me to?
Yeah, sure. I think that is more specific. So this new partner is just coming. So from what I'm understanding, the new partner is just coming to the table and has not worked with this team, but there's been success between the Rowan and the Rutgers Camden partner. Our goal is really to make sure that the partnership can work together successfully. Naomi, what are your thoughts?
Yeah, this is a tough one. I mean, technically speaking, no, you're not eligible for track 2 unless everybody's been involved for 6 months. But what I think also is that if the 2-month-long collaboration, if the 2-month-long 3-way collaboration has gone particularly well, and you can sort of show that in some way, and the longer Rutgers and Rowan collaboration has gone very well, and you can show that in some way, then it wouldn't shock me if the reviewers could be persuaded to apply a higher level of funding than the track 1.
Yes.
So I think this would kind of be one of these like in between things where I would encourage the team to make the best case possible, both that they need the higher level of funding and that they really can, they have the experience to work together, not can work together like everybody's a nice person, but have the experience to know that they will be good research partners together. And then if you can do that effectively, I think it wouldn't be ridiculous to apply for a somewhat higher level of funding than the track 1. That's my thought, but Nicole, I defer to you.
Yeah, I think, I mean, I'm of a similar mindset. really showing that that partnership, the initial partnership has been very successful, and anything that you can show to show that that new partner will be fully integrated into an already well-working established team, and using, like I mentioned before, some of that, your preliminary work and data to support what and show what you've already done will be really critical, I think, during review.
And also, just as a point of information, last year when track 2 was announced or started, there were a couple cases in which there were applications for higher levels of funding that, for whatever reason, maybe we weren't comfortable awarding the higher level of funding, but we reached out to the investigators to discuss whether they could do a core aspect of their project with a lower level of funding. So if you were to apply for a higher level of funding, if you felt like you had that good justification and that solid track record, even if it's a little bit shorter than the requirement, then I think we wouldn't just like rip up the application if you didn't make such a great case. We'd instead probably reach out to you and say, we do have concerns about this 2-month thing. Do you think you could do a more modest version of the project? And just ask information from you.
And that's a good point. So that's one of the criteria is the budget and the scope. And so, all of these projects go through multiple layers of external review. And so the reviewers in reviewing that project can really speak to, whether, the level of funding and the need for funding for that particular project. So making the best case, having a very strong research focus really is what we're aiming for all projects to do.
Yeah, and I think for Janine's question that she just reiterated in the chat, I'll chime in, Nicole, but then please respond if you think I'm speaking incorrectly, about because the Rowan and Rutgers Camden partners were students, by definition, they couldn't have had more than a 6-month partnership with those people because they've graduated now. And I think, unfortunately, I don't think with brand new Rowan and Rutgers Camden partners, you can apply as an existing partnership. Unfortunately, which is another reason that this time around, we sort of learned from our past experience and are requiring a faculty sponsor for each project in which a student participates. And I'm sorry about that, because it sounds like you've made great progress and are motivated for track 2. But if the Rowan and Rutgers Camden partners will be totally new, I don't think that's possible. Nicole, do you want to chime in?
I don't think that's possible given the criteria for cycle 3. Next slide. So if the projects are awarded at the full proposal stage, how will the funding flow between the entities? Is the funding awarded to the academic institution or to the community organization, or both? So in each project, there is what's considered a PI. So there's one PI for the project. That can be either the Rutgers Camden partner, it could be the Rowan partner, or it could be the community partner. That is up to your team to decide. Whoever is the PI for the project, that's where the grant dollars will flow. And the grant dollars will then flow from the PI to the other partners. So for example, if a community partner is the lead on the project and is serving as the PI, we don't want to make that distinction. You make that distinction as a team. Then the community partner receives that funds, and then they subaward out to the 2 academic partners. And then vice versa, if the academic partner is the PI, then those funds would flow in subawards out to the other academic partner and to the community partner. Specific and that's how the disbursements will be. I'm interested in this initiative, do not have a specific project idea, would be open as an individual entity to share my contact information or skill set. Where do I submit your information? We are absolutely welcoming of any individuals that want to learn more and be informed of SGIPH work. So please submit your information in an email to info@sjiph.org, and we would love to connect with you. Can an individual researcher or community partner be a member of multiple projects at the LOI stage? Are there any limitations of how many faculty can work together on one project from Rowan or Rutgers Camden? Yes, we absolutely have had in the past. Yes, we can have individual researchers and community partners be a part of multiple LOIs. We have had that in the past. You cannot have multiple PI projects, so you can be part of other teams. All ideas and projects are welcomed at this stage. So there are no limits on the number of faculty that could work on a project, and that, like I mentioned before, there has to be one lead faculty member or one lead community partner that is coordinating and the PI for the project. Next slide. To be eligible for Track 2 funding, are we reading correctly that the team would have to consist of the same members of the team that received Cycle 1 and 2 funding? You do not have to have the same team members as you had for Cycle 1 or 2. However, your team has to be an established team. So established means that you've worked together on previous projects for 6 months or more. And Naomi did go into a further explanation regarding the specific question that we received. If the team has received Cycle 1 funding and applies for Cycle 3, can funding within Track 2, can the project have some crossover with Cycle 1 project? If you decide to apply with the same team that you had for Cycle 1, you need to have a different research question. And so the project cannot be a direct extension of your Cycle 1 project. Your preliminary data can come from another source, and you can use your Cycle 1 preliminary data if you have that available before the LOI is due on the 23rd of June. So if you have that data already and you're able to include that in your LOI proposal, that would be good to do. Next slide. So those were the questions that we received regarding our Cycle 3 funding announcement. We welcome all of you to apply. Please share the announcement and the funding initiative widely. The letter of intent submission deadline is on June 23rd at 5 p.m. So we will conclude this webinar. If you have any additional questions, please email us at info@sjiph.org. Thank you.
Thank you, everyone.
You can stop the recording.